So she's gonna talk to you a little bit about the different nursing jobs that she's had. She's got some activities for you. If you have any questions, don't be afraid to ask. She has a lot of expertise in a lot of areas, so make sure you ask questions. Thanks for coming.
Thank you for inviting me. So as your teacher said, my name's Kate. I have been a nurse for 22 years. I went to Creighton University and graduated from there in '95. I know, well before you guys were born, right? So I went to school there, stayed local, and while I was in school, I was a psych tech. So I worked with the mental health aspect of nursing. And then when I graduated, I had the opportunity to decide, was I going to stay in mental health, or was I going to go more towards the medical, the physical side? And there was just this one person that grabbed my attention. And so when you're thinking about, maybe you're like, I have no idea what I want to do for the rest of my life. It doesn't have to be nursing. It doesn't have to be a doctor. Whatever drives you, whatever you feel like you want to do, make sure that you go for it. And I'm not plugging nursing necessarily here. I'm plugging every occupation you choose, any occupation you choose. My biggest thing is while you're here at school, I know we as parents and as teachers, we hound you and say, is your homework done? Did you study? Did you da-da-da-da? But Teresa's looking at me going, shut up, Mom. But really learn how to study here. Because when you get to college, it's a whole nother beast. So your teachers are telling you things to be successful for not only your education, but also for life. So really, whatever you choose to do, give it your all. And it'll make the college aspect so much easier. So I chose, because I had this one person that really just got my attention in dialysis. And dialysis is a kidney disease. It's a treatment for kidney disease. When people's kidneys no longer work, your kidneys are working 24/7, 365 days a year. And when those kidneys no longer work, there's a treatment called hemodialysis or peritoneal dialysis. And these individuals have to go for 3 to 4 hours, 3 times a week. And they have big needles stuck in them, or they have a catheter, or they put solution into their belly. And this is their treatment. This is their what's sustaining their life until they either get a transplant or they die. So that was something that I was really, really interested in. And so I went and applied there, and they said, well, you need to get some actual hands-on medical experience. So I went to long-term care. So psych tech in the mental health arena. Then I went to long-term care and took care of older adults. Notice I did not call them old people or old geezers, okay? You will all be old at one time, so be respectful of your elders. They are older adults. Loved that. But then I still wanted that dialysis piece. So I went there, worked there for quite a few years. As a student, becoming a nurse, I knew I wanted to teach someday, because I had some teachers that really were driving me, and I really liked what they were doing. And then, of course, even a bad experience is a good learning experience. So there were some instructors that I was like, boy, I'm just not learning well, because I was intimidated, and just it wasn't clicking. And so I knew I wanted to teach someday, because I really liked that piece. Well, it kind of made me have to go back to school. Okay, we know how we all like school, right? 8 a.m. Yeah, see, you're awake at least. So I had to go back to school. And it was tough, but it was worth it, because now I not only get to take care of dialysis patients, but I also get to teach. And so I have been at Nebraska Methodist College for going on 9 years. I still do both. I teach first semester sophomores, so I may see you in a few years. And I love it. And so as nurses, no matter what you think you want to do, a lot of people come in as a I want to take care of kids, I want to be a pediatric nurse. And then something, again, catches their attention and they want to do something else. The great thing about nursing is there are so many different places that you can work. And the great thing is that, well, it's great for a lot of people who are getting older, because they're going to be retiring from nursing. By the time you get to where if you choose that career, there's a shortage coming up, a big shortage. And so while when I was coming out of school, I had to have experience in something with a shortage. If you want to go to ICU, they'll train you in ICU. If you want to do, cardiac, they'll train you in cardiac. If you want to do dialysis like I wanted to, they'll train you. So that's a great thing. So not only do you have many opportunities available as a nurse, you could be sitting behind a computer and auditing charts. You could be having that one-on-one individual contact with people. There's so many choices, okay? Does anybody have any questions as far as, anybody here have a nurse in the family or a good friend? Okay. Anybody know they want to be a nurse someday? Okay. Do you have any ideas of what you want to do, or?
I'd like to be a midwife or NICU nurse.
Okay. And did something pull you that direction and experience something from your life so far? Yeah. And then who else? What do you?
I wanted to go into pediatric nursing, so with kids.
Yes. Yeah. Okay. So it's a great career choice. Absolutely. And if some of you are sitting on the fence about it, then definitely it's you go visit places. Okay. This city is loaded with schools, and that is such an advantage to us being in Omaha that there are so many different school choices. So you're probably tired of me talking, right? No? Do you have any questions? Any questions for me? No? So I brought a few things for you to play with. And one of them I will pass around, a couple of them I'll pass around. So being in the renal world, one of our drug reps brought this in. There's no Blue's Clues or Dora or anything, so I'm not taking you back to when you were a toddler. There are pictures of kidneys here, and so it actually will tell you right at the top what you're looking at. So you can see the anatomy of the kidney, the full view of a healthy kidney, the cutaway view of a healthy kidney, the inside, how the blood runs through, and then you can actually see a diseased kidney. So these are actual pictures for you to look at. So go ahead and just look at those and pass them around. See, I try to get your attention first because as soon as I start passing stuff around, you're like, not listening. Does anybody know what this is called? You're going to be our first volunteer.
Let me just put my stuff down.
Does this help if I do this? What is it checking? Oh, I'm just kidding.
Oh,
A pulse. It's a pulse oximeter. Okay, so it does make noise, and I didn't figure out how to shut the sound off because I took it from our nursing arts center. And so you can pass this around too and see what your pulse reading or your O2 sats are. And so it'll tell you what your pulse is, and then, oh, that's really loud. Oh, that's not helping. It'll tell you what your pulse is, and then it will also tell you what your O2 sats are. Does anybody know what your sats should be?
Do you know what she's talking about?
That means there's nothing there. So your pulse oximetry, your oxygen rating is how much oxygen is going through your system, okay? Your body needs oxygen to live, otherwise we'd all be blue and dead right now, okay? And maybe the heat in the room might make you feel like you're turning blue and dead, just kidding, okay? So that, you can see what your pulse is, and your pulse is your heartbeat, and then also how much oxygen you have in your body. So everybody should be close to 100%. Like 90, 95 to 100% is what most of you should be. Does anybody know what would make somebody's oxygen saturations drop? So here's where I'm going to plug smoking. Okay, if people smoke and have diseased lungs, okay, they're not getting a good inspiration, expiration out, and circulation isn't as good, so they're going to run a lower oxygen saturation. Or if they have some sort of maybe even asthma or emphysema, any type of lung disease can make your O2 sats low. Okay. Is it because it's 8 o'clock in the morning that I have a lot of little glassy eyes?
This class is always pretty
Are
quiet.
you really quiet
Yeah.
and good? You're not even commenting on that. Okay. All right, so then this, does anybody know what this is? What is it?
Checks the ears.
It checks the ear, so it's an otoscope. Now, so that Miss Krieger invites me back, you need to be careful with this, okay? I have a couple little activities that we can break up into 3 different groups, and you can play with these things, okay? But we are not gonna puncture anyone's eardrum today. Do we understand? Everybody nod their heads yes, you understand. Okay, so you're gonna be able to, I have little probe covers here, and you're gonna be able to look in each other's ears if you so choose. You do not have to do it. What you'll do is you will take the top of the ear here, and you're gonna pull up and out, and then you're just gonna insert it just a little bit, and then you can see, and you should see a pinkish, grayish, kind of a shiny, okay, and just look around. We're not looking to identify things, I just want you to be able to see inside the ear. Has anybody done this before, seen inside ears? You have? Well, you're like on top of things, aren't you? Kind of. Okay, so we'll have that to play with. And then I have these stethoscopes. And the fun thing about these, usually the stethoscope is just one of these. But the fun thing is that as you pair up, you can listen to each other's heart and lungs. Okay, so you're gonna hear the same thing. And you can take alcohol wipes and clean them off between uses, okay? So you can put it on somebody's chest. This is where the heart will be. You can move anywhere in this vicinity, okay? The lub-dub sound is gonna sound louder in certain places. You just go ahead and listen to the heart and move it around and see if you can hear any differences. Lung sounds, we have a strategy for it, but you can just do however you want to do. But typically what we'll do is the front and the back and even the sides, because how many lungs do we have? 2. And it's important to listen front and back. And so we'll do very systematically, start up here, move across, move down, move across, move down, move across, down, and go that way, okay? Same thing for the back. You just play, bless you, okay? So that's the other station that we have. And then this station I will be supervising myself, because what we're gonna do is I drew up some injections for you to get, bless you, okay? It is just water. And so that your principal doesn't make me move from Papillion, move me to prison, exactly, we are going to be very careful with these, okay? Which is why I will be up here supervising. I have drawn this up for you. So I will demonstrate what is the first thing with any of these things we would do before we touch a patient. Wash your hands, absolutely, okay? We have lots of bugs going around, right? How many of you have been sick recently? It's nasty, isn't it? Okay, so hand washing is the #1 prevention of everything, okay? So we're gonna come up here and you're gonna use your hand sanitizer, okay? And then you're gonna grab some gloves, there's mediums and larges, and you're gonna grab an alcohol wipe. Here's your patient. These are your patients. All right, when I teach med administration to our nursing students, their first patient is an orange. All right, we have these awesome high fidelity mannequins that they also use, and also some injection pads that they use. There's obviously nothing like the real deal, but oranges have that skin, and depending on if there's somebody who like a farmer who's been out in the sun will have really thick leathery skin. My dad, who was in an explosion and had to have skin grafts, he had very leathery skin. Your older adults, or maybe even your babies and toddlers, they're gonna have pretty soft, thinner skin, okay? So it's all gonna be in the technique of how you have to assess the skin and see how much oomph do you have to have behind that force. So you'll have the opportunity to do that. So, if I were to start this from scratch, what I would do is, in this package is the syringe and needle, okay? And so we will open it, if I was starting from scratch, I did my hand sanitizer. This is just bacteriostatic water, but we can pretend it's a medication. I would scrub the hub because there's bacteria sitting up here and I don't want to inject in anything. Okay? And then what I'm going to do is, in order to get something out of here, I need to put something into here. So everybody's dose is 0.2 milliliters. And so I have to put some air in here. So I put the air in, and then I'll pull out. And I want to make sure that I don't have any air bubbles, not because a big enough air bubble can hurt someone, right? But with a small air bubble in here, what happens is that they have a dose that's ordered for the patient. And if I don't get the air bubbles out, then it's taking up space. And if I'm taking up space, then I don't have the right amount of medicine in there, okay? So I'm gonna flick it and beat on it a little bit. Oh, it filled up itself. There's a lot of pressure in there. Okay. Oops. All right. So there's my dose with a few extra little things, okay? And then I will put the cap on it, and it's ready to go for the patient. At that point, I'm gonna wash my hands again, and I'll put gloves on. Okay, so that's the point that you're gonna come up here, and you'll be able to grab a syringe that's in here, and I will walk you through. So I have 4 oranges, so I want 4 at a time. And then while we're doing this up here, you can grab the otoscope, and then also the stethoscopes, okay? So should we just do like the first 4 and then the next 4 kind of thing? Or I'll let you decide.
Yeah, no, that's
Okay.
great.
All right, so stethoscopes. I'm gonna let you untangle them all.
So you
That's
first
your
and
job.
then I just wanna-